Blake Staker here with Westside-Medical. Today we're going to go over wrist traction, how to set it up using voodoo floss developed by Dr. Kelly Starrett and Westside's band here. So first, the voodoo floss is going to wrap around the joint, and the purpose of this is it's going to compress that joint, and that compression is going to squeeze out the inflammation from the wrist injury. So let's get started here. Now I go probably about 50% tension rate, because you're going to have it on for more than 2 minutes. If you just want to just use it strictly for flossing out the adhesions, you can go heavier, but you're going to get to a point where you're going to want to, your body's going to tell you to take it off, and that's not going to be quite long enough to traction out the wrist. So go about 50%. You want to overlap here. Once again, this is going to compress the fluid and the inflammation you have in there. It's going to compress it out of that joint and back into the lymphatic system. And also, when you wrap with this, it makes it a little more comfortable for the traction setup, because the bands dig into the skin a little bit. Probably would be easier to have somebody else put it on you if you have a training partner, but if not, you can hook it on yourself here. And once again, if you get it really tight and you're starting to experience some numbness in your hand, it's a good sign you want to take it off. Let's get it hooked on there. There you go. And then for the setup, you take these bands you can get at Westside Barbell here. Gonna make a, can you see that over there? Gonna make one loop, hook it in here, get it tight, make another loop, and you want the bands on opposite sides of the wrist here, like that. So you just traction your wrist out. There we go. So you're going to keep your wrist relaxed, and it's going to pull and traction just like this. It's going to pull apart those carpal bones, and you go through a circular range of motion. And that motion is going to help pump that inflammation out. You want to sit, relax, traction it, roll it both directions here. This is really good for osteoarthritis. If you ever injure a triangular fibrocartilage, right through there, it's going to help traction that out. It's good for like a sprain strain of the wrist, probably a little bit later on in the healing process, maybe about week 3. Once again, you want to just traction it for about 2 minutes. Relax, just feel like those carpal joint open up, and just rotate. And that motion, those muscles contracting, pushes that inflammation into the lymphatic system so it can clear out, and it allows healing to take place. There we go. Good. So hopefully you guys found that useful. So visit us at westside-medical.com.